grew up in this area, um, and I guess, the simplest label would be an activist business person. Um, Spent my 20s organizing against nuclear power and weapons and went to jail for 3.5 months for civil disobedience at nuclear power plants in an effort, and weapons facilities in an effort to expose a disastrous public policy, and learned the power of direct action and the fact that there were 1,000 reactors planned for the year 2000. There's 90 and dropping is an indication of what the environmental movement did to lessen the impact of the environmental catastrophe of nuclear power and weapons. And if radiation caused acne, we'd never have it because we're too vain for that, but it's just bad public policy, fancy way of boiling water, and thankfully the environmental movement figured out a way to stop it for the most part. Using that experience as a carpenter and turned into a developer, and realized, frankly, that good public policy leads to good public health outcomes, and bad public policy leads to disastrous public health outcomes. Started the Friends of Boston's Homeless in 1987 when I learned as a housing developer that 25% of the homeless worked regular jobs and couldn't afford housing in the city of Boston. And again, bad public policy leads to bad public health outcomes. In 1980, the HUD budget was $34 billion, and the number of homeless people in this country was 200,000. By 88, when Reagan left office, the HUD budget was $9 billion, and the number of homeless people were 2 million and growing. It's an affordable housing crisis, and we serve now in our shelters across the country, and in particular here in Boston, the working poor. Again, bad public policy leading to bad public health outcomes. As a gun owner, in 1995, I started Stop Handgun Violence when I became aware that 106 Americans died every day from guns. I guess I'm going through this without realizing it. Just before I get to that, so again, I found out, I built that big billboard on the Mass Pike that you might have seen, 252-foot billboard starting with beautiful color photographs of kids killed by guns, said the cost of handguns keep going up, 15 kids killed every day. In 1994, when we started this program, as a gun owner and a business person, I realized that really this is gun violence by design in order to sell guns, and nothing sells better than fear. So federal gun policy is basically to provide unrestricted access to guns. 32 states don't even require background checks. There's no ban on assault weapons other than a few states like Massachusetts. Consumer protection standards regulate toy guns, not real guns. 100 people die today, 250 people will be wounded, and there'll be a mass shooting today of 4 or more people. And frankly, there was a mass shooting of 550 people, 58 dead, at Las Vegas, and Massachusetts was the only state to ban bump stocks. The 37,000 deaths last year in America from gun violence will be over 40,000 this year. And if every state, if you saw this great Boston Globe piece, if every state simply had the same firearm fatality rate as Massachusetts, we are an urban state that regulates gun dealers, manufacturers, gun owners, and law enforcement. We have the lowest gun death rate in the nation. We've reduced the rate of gun deaths by over 40%. If every state simply did what Massachusetts did, good public policy, the 37,000 gun deaths last year would be 27,000 less, simply by having the same good public health policy and governmental policies that Massachusetts had. So using those models, when the Gloucester police chief approached me and said, we can't arrest our way out of the disease of addiction. This is a disease that has largely been created, like bad public policy, greed around lack of affordable housing, greed around unrestricted access to guns, to increase gun violence, fear, and gun sales, and special interest politics where Congress goes along with the gun industry, not public health and safety. Same thing with opioids. We can't arrest our way out of a public health crisis. This has largely been created by greed on the part of, and fraud on the part of the pharmaceutical industry, largely Purdue Pharma and the creation of OxyContin, combined with basically allowing direct marketing of pharmaceutical drugs by the FDA in '96. By 2008, the number one cause of accidental death in America was overdose deaths. That was 10 years ago. Last year, the most recent year we know the numbers on, 72,000 overdose deaths. And anecdotally, through the 438 police departments that I'll tell you about that are in 32 states that are providing law enforcement-based access to treatment for anyone with the disease of addiction, non-arrest basis, for every overdose death, there are 9 saves with Narcan. If not for Narcan, the 72,000 deaths last year would be closer to 700,000 bodies piled up as a result of a public health crisis that Congress refuses to do anything about. So this police chief in Gloucester, Mass. Approached me saying, geez, you've had success setting up nonprofits. He posted, starting on June 1st of 2015, he was going to announce that anybody with the disease of addiction could come to the Gloucester Police Department with or without their drugs and paraphernalia. No shame, no blame, no arrest, get into access to treatment. We had no idea whether anyone would show up. He posted the post. He got 2 million hits. You know, this is a town of 28,000 people, small police department of 60 people, 60 officers. And he approached me and said, 2 million hits. I have a feeling that this thing could take off, and we need to set up a nonprofit to help sustain it. So we created the Police Assisted Addiction and Recovery Initiative. It's a law enforcement-based access to treatment, non-arrest. No shame, no blame, no arrest, 24/7 access to treatment, like emergency rooms should do but don't often. You know, police are on the front lines. And like with any chronic disease without a cure, there's only 2 options. It's either long-term treatment or death. That's it. Yet when you have cancer, heart disease, diabetes, any other chronic disease without a cure, you go to an emergency room or you go to the healthcare system and you're treated with respect. You're given medication, which extends your life. But when you go to the emergency room oftentimes or the healthcare system with the disease of addiction, you're often treated like this is a moral failing, that you brought this on. Forget the fact that 80% of people that end up using heroin start with legally prescribed, aggressively marketed pharmaceutical drugs. So, fast forward now 3.5 years, there are 438 police departments in 32 states providing access on demand to treatment. We have 2 primary programs. We have an intake model where, like Gloucester Police, you can come in to the Gloucester Police Department with or without your drugs, not get arrested, and within that day get placed into treatment. And in most cases, we're now placing people into treatment just over the phone. But the numbers are staggering. I mean, nearly 200 Americans today and every day will die from overdoses. And access to treatment is very limited. So this is the Gloucester model. The other model that is quite sort of game-changing is the Arlington police model, where the Arlington Mass Police Chief, Fred Ryan, realized that the greatest predictor of the next overdose death is today's overdose save. You know, they realized they largely know who is most at risk in the city of Gloucester, and in Arlington. So his is more of an outreach model. So one, when there's an overdose, save within 24 hours, go to the home of the user with a clinician and an officer and offer treatment. And if somebody isn't ready for treatment, they give them Narcan to help save their life, or give it to the family member who could help save their loved one's life. He also figured out that when his detectives are ready to arrest a drug dealer, he would require that those detectives also have an outreach plan for the users, because he was going to have a public health crisis in the town of Arlington. As soon as he arrests that dealer, now he's got a bunch of clients and users who are going to be looking for help. They're going to be looking for the next dealer. They're going to end up using a different cocktail, a different mix that could be more fentanyl than heroin and die. So what they would do then is they'd arrest the dealer, they'd get their phone, they'd get their client list, and then the next day they would go to the users' homes and say, we've taken your dealer out of circulation. Rather than find a new dealer, how about getting into treatment? And we'll bring you there today, and if you're not ready for that, here's some Narcan that'll help save your life. Both of those programs, are a recognition that this is a public health crisis that law enforcement cannot solve. But like every other chronic disease, we need a long-term treatment system. And until that happens, law enforcement's going to be there because they're open 24/7 like emergency rooms, but there's no stigma associated with coming to the police versus the stigma associated oftentimes with how you're treated in the emergency room. So what we do is we simply are an entry point into treatment. And one of the things that was sort of an aha moment for us, we had no idea, sort of an unintended consequence. There were several, but one was we didn't realize, one, if anyone would come and trust that they wouldn't be arrested. Well, they did. In Gloucester, over 600 people have come in. Over the 438 police departments so far, including the state police in Michigan, the state police in Rhode Island, the Boston police, the Salt Lake City police, the Anaheim police. I mean, the list goes on and on and on. People are realizing that their police are their friends. At a post-Ferguson era, that is quite something to be building trust with police on a community level. What they also didn't understand is how broken the system is when law enforcement can place people into treatment in a healthcare system better than the healthcare system. So we provide unrestricted, shame-free access to treatment oftentimes it starts with detox. And we also now have 25 AmeriCorps members here serving 70 police departments in Massachusetts. We'll roll this program with AmeriCorps out across the country, where the recovery coaches are embedded with police departments in order to help the police place people, because it's turning into quite a lot more work than oftentimes police should be doing. If somebody comes into a police department, and this is a relapsable disease, and I am not a doctor like maybe many of you, and you probably know more about the science than I do, but what I have come to learn is that the opioids are designed to go to the part of your brain where you feel pleasure and make dopamine, and pretty much take away your ability to feel pleasure and make dopamine while you're using these opioids. And the craving is so great, you'll give up your children in order to get the next fix, just to keep from withdrawing. We need a long-term treatment system, and oftentimes the only access to the system is through detox. Detox is usually a 3 to 5 day program and there's very little access to long-term treatment beyond the detox. So we're just spin drying, which is why so many people are just dying. The police are saving with Narcan, arresting, rearresting, and end up, taking people to the morgue. And police are just really, really sick and tired of it, like families have been for a long time. So what we didn't realize is that, like all of us, we grow up learning not to say no to police. Well, people that work at treatment centers are the same way. So, whereas I had a nephew, 34-year-old stockbroker, MBA from Suffolk, overprescribed for back pain and ended up dying of a fentanyl overdose, I can't tell you the number of times my brother had to call treatment centers and be told, sorry, no room. Come back, call tomorrow, call in 7 days. But when a police officer calls a treatment center, all of a sudden there's room. And as this was reported, our program was pretty cutting edge, sort of like man bites dog. Police are providing pre-arrest, non-arrest access to treatment. Treatment centers all of a sudden realized that maybe the conversation is going to change, and they started calling us saying, we'd like to join PARI. We have now 250, close to 300 treatment centers who will provide scholarships for anyone that doesn't have insurance. So we literally can place people into treatment. And in 3.5 years, we've placed over 20,000 people into treatment through our police departments. And we are soon going to be 500. We're in 32 states. My guess is by the end of next year, we'll be in every state. And we've also been helpful in obtaining federal funds, like the CARE Act and $1 billion for treatment. In the previous administration, we were invited to the White House on a regular basis by President Obama and his chief of staff when they realized that this is one of the few issues that crosses the aisle. There isn't a single Democrat or Republican congressman or senator that doesn't think that the opioid crisis is epidemic proportion. It just comes down to whether they're willing to fund the billions of dollars that it's going to take to create a long-term treatment system that, frankly, the pharmaceutical industry should pay. My guess is over time they will be forced to. But every year that they don't, that's going to be 80 to 100,000 more Americans dead from a manufactured crisis based on greed and bad public policy. I mean, this kind of tells the story. I mean, this is the New England Journal of Medicine writes a piece that says that the Gloucester Police Department, the small little Gloucester, Mass. Police Department, was able to place people at a rate of 94.5% into the healthcare system, into treatment, compared to the healthcare system at 56%. How broken is a healthcare system when police can place people into treatment better than the healthcare system? So we created PARI as a 501c3. It's growing. Membership is free. You simply have to have a recognition to join. You just have to have a recognition that this is a disease, not a crime. It needs treatment, not jail. And there's two solutions. It's treatment or death. And if law enforcement can play a role in getting people into treatment until the pressure is big enough, until there's enough people who are willing to get involved in this democracy and force Congress to create a healthcare system for this disease like every other, police are going to do what they can. And they're doing an amazing job. And not only has it built trust in the communities between police and the community, we've seen a 30% reduction in ancillary crimes associated with addiction in Gloucester, like breaking and entering, smash and grab, shoplifting. It's no wonder. And, like the crack epidemic, which was truly an epidemic, but no one really cared because it was largely black kids in the inner city. Now it's white kids in suburban and rural America, and it's an epidemic. And it is. And it's been raging for over 10 years. It's done a lot for law enforcement. I mean, this is the chief down in New Bedford. I mean, it's incredible. You know, the majority of law enforcement in this country, I mean, they get into it for the right reasons, to serve and protect. We have put more on them than they should have because of bad public policy and greed. And they are totally stepping up. I mean, think about, just in 3.5 years, police across the country have placed 20,000 people into treatment. And when they relapse, they come back and they, you know, no judgment, bring them back to the treatment center when they're ready. It's a unified voice. As I mentioned, you know, the previous White House would bring us down to talk to members of Congress. We really switched a bunch of conservative Republican senators' votes to get the $1 billion for treatment last year. You know, sadly, this administration, you know, we've been asked to come to the White House on a number of occasions, you know, and to have, you know, our law enforcement officers in uniform stand with, you know, frankly, you know, an amoral president who is all talk, no action, and nothing's happened. Unfortunately, you know, as a result of not enough access to treatment, and in particular, in the meantime, Narcan. I mean, imagine, you know, if the flu were killing, and 72 to 80,000 Americans a year, you don't think that we'd have the flu vaccine out there? I mean, there needs to be enormous reserves of Narcan, and it needs to be in the hands of every family and every user. It's the only thing that is, you know, you can't get somebody into treatment if they're dead, and the only thing that's going to stop the overdose is Narcan. Use it. And that's what these police departments are doing. I mentioned the outreach model. I would say that, you know, of the 438 police departments, you know, we probably have half and half doing the intake and outreach model, and I think there are truly thousands of other police departments that are doing the program without joining part. The fact that the treatment centers are willing to offer scholarships has been an enormous benefit, because, you know, Massachusetts, just about everyone's insured, but, you know, we're getting people from Maine, New Hampshire, Vermont, right over the border who aren't. So we're able to place people with or without insurance as a result of the generosity of the treatment centers. It's a movement that's growing, and it's really given police sort of a new lease on helping keep people out of the criminal justice system, which, you know, there's enough chaos in people's lives who are using and who are addicted. The last thing you need is then to arrest and then give them a bad Corey if they don't already have it, and then that just complicates their life with jobs and housing. So with our recovery coaches now across the country, we have, and all of our recovery coaches are in recovery themselves and certified recovery coaches. They are helping when people get out and go to the next level of treatment. We've worked closely with the Baker administration, and if you're not from this area, you should really see what the Massachusetts legislature and governor have signed into law with regard to addressing the opioid crisis. I would say there's, you know, landmark legislation that this administration has championed, along with House Speaker DeLeo and the Senate President, that is cutting edge, leading edge. You know, very few people probably know that most medical schools didn't even have a pain management curriculum. Massachusetts now has it, requires it, and you also can't be released from the emergency room after an overdose without a discharge plan, so the next level of care. And then when people come out, the recovery coaches are doing the same with the police. We are all over the country, and in each of these areas, we also have treatment centers, not only police departments. That shows, you know, roughly 18,000. I think we're up to 20,000 now. all of the various sort of unintended but good consequences to doing this program, not the least of which, is building trust, reducing crime, and saving lives. If we have 70 police departments or closer to 80 police departments here in Massachusetts. If your community isn't doing it, you should have them get in touch with us. Again, there's no cost. As soon as someone joins, they get our policies and procedures and guidelines and a list of 250 to 300 treatment centers who will take anybody when a police officer calls. We have a summit coming up at Harvard Medical School, which for law enforcement and treatment centers, treatment providers, as well as anyone else that's interested. That's coming up on December 6th and 7th. And this is how you can reach our executive director, Allie Hunter McDade. So there's a lot of reasons people medicate, and we all do it. Some are more prone to addiction than others. Sadly, heroin has gone from pure to not to now being replaced with fentanyl. Fentanyl is 50 to 100 times more powerful than heroin and morphine, and it's being disguised. I don't know if you know this, but the new sort of huge concern that's coming up, so the Chinese were largely sending in through Mexico not only fentanyl but pill-making machines. So on the street, for instance, once you get shut off from your doctor, let's say an Oxy 80 milligram is $1 a milligram on the street. So it's $80 a pill. You need 5 to 10 just to be able to go to work, just to keep from withdrawing. If you've come out of prison, you're really most at risk because your resistance is so low. But at $80 a pill, it's not long before you go broke, steal from everyone you know, lie to everyone you love, and end up with heroin. And then from heroin, you're getting cheaper fentanyl, which is disguised and cut with heroin. And you can even buy pills that are stamped Oxy 80 or Perk 30, the same color pill, that's fentanyl now. And it's disguised, which is having a huge impact. Roughly, the folks that will overdose, the 6 to 8 today in Massachusetts, the 150 to 200 across the country today, they will, in all likelihood, have at least 50 to 60 to 70% fentanyl in the mix that kills them. And that is not going to change. So what we need to do is have access on demand with medication like we do for every other disease that doesn't get shamed, blamed, and stigmatized. We need to hold our members of Congress accountable and the White House. And the voice of law enforcement has helped change the conversation. And we will continue to do that until enough of us get involved enough in our democracy to hold Congress accountable and the White House accountable to create a healthcare system that is blind to one disease versus another. Thank you.